In this episode, we're talking about why your recurrent miscarriages aren't just bad luck, as well as the answers and solutions that your doctor is missing. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant, so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In this episode, you're going to learn the overlooked physical and functional root causes behind repeat pregnancy loss, why standard testing often misses the real issues, and what advanced functional testing can reveal, and actionable steps to advocate for deeper investigation so you can finally carry a healthy pregnancy to term. So often, recurrent miscarriage is brushed off as bad luck. It's common, it just happens. But I'm here to tell you there is no such thing as bad luck when it comes to your body's ability to carry a pregnancy. There are reasons, and in most cases, they're completely missed by standard fertility workups. So today I'm going to share the hidden causes of recurrent pregnancy loss that almost no one is testing for, and what you can start doing today to uncover them so you can protect your next pregnancy. So, if you have experienced 2 or more miscarriages, you've likely been told it just happens sometimes. This is normal, right? Or maybe it's just bad luck. You can try again, and hopefully, next time will be different. And maybe your doctor even told you they won't do any testing until you have experienced 2 or 3 or even more miscarriages. And that is absolutely ridiculous because repeating the same thing, the same plan, without uncovering the root causes means you're gambling with your heart, your emotions, your body, your time, because I have had women take quite a long time to actually have their cycles re-regulate after a miscarriage. And just remembering that recurrent miscarriages is not a random event. It's a message from your body saying something here needs to be addressed. So here are 8 hidden causes that no one is testing for. So number 1, undiagnosed thyroid dysfunction. So even a quote unquote normal thyroid lab can mask problems. And I've had so many women tell me in the DMs on Instagram their thyroid is normal, but we actually don't have the whole thyroid picture, and that's a problem. So TSH in the higher range, above 2.5, even above 2, can increase miscarriage risk, even if your doctor says it's fine. Having antibodies present, especially with Hashimoto's, can attack pregnancy tissue without causing any obvious symptoms. And honestly, standard labs that your doctor is running often skips thyroid antibody testing entirely. So an action step for you is advocating and requesting a full thyroid panel. So this would include TSH, free T4, free T3, reverse T3, and thyroid antibodies. A full thyroid panel is something that I'm doing with every single client. Number 2, hidden infections and chronic inflammation. So vaginal infections like bacterial vaginosis, chronic yeast, ureaplasma, mycoplasma, even gum disease can trigger an immune response that interferes with implantation or fetal development. If you have low-grade uterine infections like endometritis, this can often go undiagnosed unless you specifically request testing, and you may not even have any symptoms. So an action step for this is you can discuss the possibility of a uterine biopsy or pursue vaginal microbiome testing, especially if you've had multiple miscarriages with no explanation. So a vaginal microbiome test is something I do with every single client, And I do have a current client who has had 5 miscarriages. And when we got her results back, she had a lot of vaginal dysbiosis going on. She had a couple of strains of bacteria that are not fertility friendly, and she didn't have any protective flora present in her vaginal microbiome either. So we worked on this together, and now she is currently pregnant, and it has been a viable pregnancy, a healthy pregnancy so far. Number 3, MTHFR and methylation issues. So this is about your body's ability to process folate and manage homocysteine levels, which directly impact blood flow to the placenta. MTHFR gene variants can mean that you're not able to convert folic acid into active folate efficiently. Now, this is especially an issue if you are taking a prenatal supplement that contains folic acid instead of a methylated folate vitamin. And unfortunately, conventional doctors are still recommending folic acid for whatever reason. And elevated homocysteine levels can be linked to clotting and pregnancy loss. So, some action steps here are you can request a test to see if you have any MTHFR mutations, which over 50% of the population has some degree of a mutation there, and your homocysteine levels. And if present, you can switch to methylated folate and methylated B vitamins. And I also recommend avoiding foods that are enriched with folic acid as well. Number 4, blood clotting disorders. So these are very rarely checked until you've had 3 or more losses, and that is just unnecessary, okay? So this could look like factor V Leiden, prothrombin gene mutation, antiphospholipid syndrome. All can cause tiny clots in the placenta, and this can prevent the embryo from getting optimal oxygen and nutrients. So an action step here is you can request a comprehensive thrombophilia panel after your first or second miscarriage, not your third or beyond. Number 5, hormonal insufficiencies, especially progesterone. So progesterone's job is to maintain the pregnancy. And if levels are too low, the uterine lining can't support the embryo. So the problem here is standard labs often check progesterone once instead of over the entire luteal phase. Another issue is a lot of times we're testing on cycle day 21, assuming that ovulation happened on cycle day 14. But if you ovulated later or earlier, then cycle day 21 is not going to give you an optimal progesterone result. So an action step here is you can ask for consecutive progesterone testing, ideally 3 to 4 draws after ovulation, and advocate for luteal phase support if needed. Number 6 is poor egg quality from nutrient deficiencies and oxidative stress. So egg quality isn't just about age, right? That's not something that just goes down because of your age. It's about the environment your eggs mature in, and deficiencies in nutrients and minerals can affect chromosomal health. And then also oxidative stress from toxins, poor diet, or unmanaged stress can damage eggs before fertilization. So an action step here is you could do functional testing like an organic acids test or micronutrient panels, which can pinpoint where your body needs the most support. So these are tests that I do on every single female client. So we're looking at your micronutrient status, but also what specific antioxidants can help reduce oxidative stress on your cells, okay? Number 7 is immune dysregulation. So, overactive natural killer cells or an imbalanced immune response can attack the embryo. This is controversial in conventional medicine, so many doctors don't even mention this. So, as an action step, you can seek out a reproductive immunologist or integrative practitioner familiar with immune related pregnancy loss. Number 8 is DNA fragmentation. So, research shows that this can be a hidden culprit behind pregnancy loss, even when a semen analysis looks normal, quote unquote, normal. High fragmentation can be caused by oxidative stress, environmental toxins, smoking, high heat exposure, infections, and even poor sleep. So, as an action step here, you can request a semen analysis or do a reliable at-home test that includes DNA fragmentation. So, every miscarriage has a reason. Sometimes it's chromosomal, sometimes it's environmental, sometimes it's both. But labeling someone's losses as bad luck or this is normal, it just happens, this is closing the door on any investigation into, is there anything underlying that we can address? And I have personally seen women go from multiple losses to having a healthy full-term pregnancy simply by uncovering and addressing the hidden root causes that was going on for them. So what you can do next, document your journey, your history, write down every pregnancy outcome, your symptoms, any testing that you have had either prior or after the loss. Demand and advocate for yourself for comprehensive testing, even if your doctor thinks it's unnecessary. And unfortunately, many doctors just don't even realize that these are things that they could be looking at. They don't really know what tests to order or look at. So then in this case, I would recommend working with someone like myself who looks at the whole picture, your hormones, your immune system, your nutrition, your emotional health, your internal and external environment. So let's recap why recurrent miscarriages aren't just bad luck. Recurrent miscarriage has root causes. It's not just bad luck. There are often hidden, testable issues that go undiagnosed in conventional fertility care. Testing matters. Digging deeper into factors like clotting disorders, thyroid function, hormone imbalances, autoimmune conditions, uterine abnormalities, nutrient deficiencies, infections, and sperm DNA fragmentation can uncover the real reasons for repeated loss. And just knowing that knowledge is power, by identifying and addressing these hidden causes, allows you to take back control, to create a targeted, personalized plan, and improve your chances of carrying a healthy pregnancy to term. So if you've been told it's just bad luck, it happens, I want you to know this. Your body is wise. Your body was created to conceive and carry a healthy pregnancy, and your losses are not random. You deserve real answers. You deserve a team that will dig deeper alongside you on your journey. And you deserve to protect the health of your next pregnancy with every tool available. And the right test could change everything for you. So thank you so much for listening. I hope you have a wonderful day and stay tuned for Thursday's episode where we're going to be diving deeper into the vaginal microbiome. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.